Good morning, everyone. Wishing you all happy Independence Day from Piramal Swasthya team. Today is our session on individual rights versus collective responsibilities around the pandemic. The session will be moderated by Dr. Pavitra Mohan. He's a Secretary of Basic Health Services. Dr. Mohan is a community health physician, pediatrician, and public health practitioner. He is a co-founder of Basic Healthcare Services that provides high-quality, low-cost primary healthcare services in rural Rajasthan. Dr. Mohan also serves as Director Health Services, Ajivika Bureau, working to improve health of the families dependent on labor and migration. He was also a senior health specialist at UNICEF India Country Office. Dr. Mohan is an MBBS and an MD from Delhi University and a Master's in Public Health from University of North Carolina at Chapel Hill. Welcome, Dr. Mohan. We have three esteemed speakers for the panel, Dr. Anand Ban, Dr. Gagante Kang, and Dr. Purnima Menon. Dr. Anand Ban is a physician with a master's degree in bioethics from the University of Toronto. He is a researcher with global health, bioethics, and health policy. He is also an adjunct professor in Mangalore, India, and adjunct faculty at Kasturba Medical College, Manipal. His work is focused on ethics and equity in health, mental health, digital health, public health ethics, research ethics, community engagement, ethics of innovative technologies, and ethics training for professionals. Dr. Gagante Kang is a professor at Christian Medical College at Vellore. It's it's heartening to know that she's the first woman from India to be elected a fellow of the Royal Society. She is also the first Indian woman to be elected to fellowship of the American Academy of Microbiology and the only physician scientist to receive the Infosys Award in Life Sciences. She works on enteric infections in children, particularly on transmission and immune responses. In order to design effective interventions, Dr. Kang received a training in medicine and microbiology at the Christian Medical College, Vellore, where she is also the professor now. Dr. Purnima Menon, a senior research fellow from International Food Policy Research Institute, very well known to all of us as IFPRI. Dr. Purnima Menon is a senior research fellow there on working on poverty, health, and nutrition division, and is based at the in Asia office in New Delhi. She conducts applied nutrition research in South Asia region with a focus on programs and policies to improve maternal and child nutrition. At present, she is leading the team that is conducting impact and process evaluations of Alive and Thrive, BMGF supported initiative to improve infant and young child feeding and child nutrition in multiple countries like Bangladesh, Vietnam, and Ethiopia. Dr. Menon holds a PhD in international nutrition from Cornell University, USA, and a Master of Science in Nutrition from the University of Delhi. With that, I hand over the stage to the speakers and the moderator. Looking forward to a wonderful session.
Yeah. Thank you, Rachita. And I'm glad to be here, not only because it's an important forum, but also it happens to be on an important day. So happy Independence Day to everyone in the panel and in the audience. I think while it's a day to celebrate, it's also a day to reflect on our constitutional values, rights, and responsibilities. And as we reflect back, we realize that there are four key values that our constitution promotes: that of liberty, equality, justice, and fraternity. But merely having them in the constitution do not guarantee it. One has to continuously examine, review, and work towards their promotion. And also, especially at the crossroads, when you're faced with emergencies or with adverse situations, how do these values play out in a day-to-day life and in the life of a nation? Uh, Coming to healthcare, health has been proposed and promoted as a human right. Um, by World Health Organization and by countries everywhere else. Health is not one of the rights in Indian Constitution. However, the right to life is, which subsumes in some ways the right to health. When faced with the COVID-19 pandemic, we saw that how the pandemic disrupted health systems, livelihoods, and economy. It also led to wide-scale devastation of the magnitude that we had never witnessed. We saw the scenes of people walking foot, beaten and broken, and of those struggling for oxygen, and they are still fresh in our memories. there were two tools, and there are two tools that we have and we had. One is, of course, the individual and social behaviors, and the second, equally important, are strong and empathetic health systems. Uh, these are the two tools that we have, and we had to face such an epidemic. During last 1 year, we witnessed that how often both the tools failed. However, in between, we also saw heartwarming examples of either of the two tools succeeding. As we are recovering from a massive second wave of the pandemic and prepare for any subsequent upsurges, and we reflect on what lies ahead, it's a good time to look at the state of right to healthcare, as well as the responsibilities we as the citizens have to prevent and manage such health emergencies, and to really critically and dispassionately view the roles of governments in ensuring right to healthcare, and of citizens to assume collective responsibility for facing adversities and emergencies like what we saw. So, taking this ahead, Anant, I would like to start with you and to ask you that, there is this general kind of a question that, do really societies that value individual rights over collective responsibility, uh, do they really fare worse or better off in terms of access to healthcare, especially in managing health emergencies? And what is the message coming from how different countries manage? Were the societies where they valued individual rights much more, or where the collective responsibility was disproportionately emphasized on? Which kind of did better? Who do you think are more responsible for the devastation that hand? It's individual behaviors and collective society, or it's the failure to manage health emergencies? Um, I can't hear you, Anand.
Dr. Ban, we cannot hear you. If you can, yeah, the audio possibly is playing around.
Um, okay, maybe while Anant is trying to get his speaker on, maybe we move on and I move on to Purnima. And Purnima, last year we really saw those horrific pictures of people returning on feet and the lockdown, and we also saw that how lockdown and subsequent decline in economy per se led to really shortage of access to food and worsening malnutrition levels. Access to healthcare decreased. Do you think is that an inevitable price that as a society people had to pay for ensuring that we were prevented from the transmission of the pandemic? Or how do we weigh these two scenarios, where individual right to livelihoods and right to move around is restricted rapidly, and on the other hand transmission of a pandemic? What would be your initial thoughts?
Yeah, thanks, Pavitra. I hope you can hear me.
Yeah, we
Okay,
can.
great. Um, I think it's hard for those of us who work on issues such as food security and nutrition to kind of forget the sights that one saw around the time of the lockdowns last year. And I think those are sites that, of course, the entire nation and indeed the entire world had a chance to kind of hone in on as really an extreme sort of impact of the lockdowns that had to be put in place at that point in time. And I say had to be put on place because at some level, I believe that the public health community and the public health policy community was working with frighteningly little information on the transmission of the virus. And, there was this, I guess, a global recognition that something fairly dramatic had to be done to, put the brakes on, circuit breakers and words like that. However, I think the social and economic consequences of that kind of a lockdown should have been apparent, and or if there had been enough conversations with people who work on issues of livelihoods, especially for the poorest, I think it would have been apparent that some kinds of protections would need to be put in place. So I think practically every nation in the world, and we had examples from China just, before that, sort of earlier in the year. We have colleagues who sit and work in China, and lockdowns were done there without disrupting things like food chains and the availability of food safety nets, etc., for people. The lockdowns absolutely exacerbated economic inequities. For many of us, who work with data and who write and do other such things for a living, in a way, removing commuting times, being able to work in the privilege of, of comfortable homes on the things that we continue to work on, was a very different scenario from what the poor had to face. For me, one of the other big challenges, or in fact, I'm going to say one of the biggest challenges here, is that while we were tracking sort of in a very diligent day-to-day, end-of-day way, you were getting numbers on cases and on deaths, and you were getting them by, by state and eventually by district and things like that. The work on livelihoods never invested in that kind of data. There was just conversation to say, oh, this is about lives and livelihoods, and eventually we'll protect livelihoods. I'm still waiting. Where is that same level of data collected consistently and frequently that tells us how the poor have been affected? What we have at the end of 18 months today is a lot of data collected by well-meaning academics, well-meaning NGOs, people sort of doing whatever they possibly could in the context of this pandemic to try to understand what had happened to those individual lives as a result of sort of this collective policy, set of decisions that had to be taken, in the face of, in those days, inadequate information, I guess. The US Census Bureau, for example, launched something called the Household Pulse Survey, where they simply asked a very basic set of questions on household food security and job losses. I think almost every couple of months, and that data has been available in public domain for researchers to work on. It's been collected across every single state in the United States. But it came from the recognition that it was important to understand what was happening to people at an individual level, so that social protection services, etc., could be deployed appropriately. This should not have been difficult. This kind of stuff should not have been difficult to do if we were going to accept fully that, in taking some decisions that were needed for the collective good at some level, and also for the individual good, because the pandemic has had tremendous financial burdens for people across the board. I have lost count of, hearing about the lakhs and lakhs of rupees that even people who got sick have had to spend. But we just haven't recognized that the livelihood side is also, it's a big deal, and that we should be tracking very carefully what happens even today, because the impacts are continuing to follow through. So, I'm also bothered by the fact that, HMIS data were simply not available after about, I think, June 2020. It's only very recently that the government's own health management information systems data came back online to actually allow us now to start to see what happened to other health services. What happened? 27 million women give birth to babies every year in this country. How many of them were missed by essential services? So there's a whole range of things that relates to people's lives that has been affected by the pandemic and the associated sort of collective policy measures or collective oriented policy measures that had to be made. And I remain concerned that we are not investing in understanding even what that has unfolded to be. And without understanding it, you're deploying a set of social protection measures. There's been a lot of, okay, let's put additional food into this program. Let's start delivering, these programs through home delivery, et cetera, but without knowing sort of how badly have people been affected, and are these measures going to be enough? So I'm still waiting, and I am still calling for the kinds of US Census Bureau pulse surveys that were done to be done routinely here, so we really understand what has happened to those individual lives. So let me stop there. I'm sure Dr. Bhan and Dr. Kang will also have some things to say about these things, so I really look forward to hearing about that.
Thanks for that, Purnima. I think what you said was why, while some of it was inevitable to begin with, but subsequently to have a better sense of how other parameters are affecting, whether it's access to food and livelihoods are affecting the, and especially the poorest, and the measures to be designed based on that understanding, which still
Absolutely.
seems to be lacking.
Yeah.
So I think your focus on what is that collective that we are talking of, and to focus on the poorest, whom we probably do not imagine in the collective often. Anant, are you back? Are you able to? No, I don't think we can still hear you. Still need to probably fix that up. So while that's being fixed, uh, moving on from the last year, one of the greatest developments over last 1 year, one of probably unimaginable and unprecedented development was, and some of the some of us were really not sure whether there would be a vaccine at the end of the year, but a really rapid development of a vaccine, and not a vaccine, but several vaccines were there. However, the access to vaccines remains highly inequitable even now, and inadequate, especially for a country of the size of India. So coming to you, Dr. Kang, you kind of you've been looking at the vaccine development very closely. You've been associated
Hello?
with some of those projects. What would you think?
Yeah, what I'm doing is I'm now removing
uh,
my headphones.
do
So
that? How do you? Why does the vaccine
when it's
coverage remains inadequate
when
and
I do the
inequitable?
setting,
And who is really responsible for that? Understanding that would help us to then frame, what needs to be done subsequently. So what do you think is responsible for inadequate and inequitable vaccination? Is it people? Is it market? Is it government?
As with most things in public health, the simple and short answer is it's complicated. The longer answer, of course, is that if we look back to where we were last year, some things were very different. One was that even from WHO and from the country, the discussion was around vaccinating a small fraction of the population. So WHO's priority list went up to 20%. The Indian government was saying that it was going to vaccinate everyone over 50 years of age. Now, 50 was very different from what other governments were classifying as elderly individuals. And when vaccines became available, it seemed like we didn't even stick to that 50. We were told we were going to have everybody immunized by July, that the government was intending to immunize. And at that time, there was a lot of discussion around why only so many, and how do you think it can be done by July? When the program actually started in January, we started like the rest of the world with healthcare workers, then rolled it out to frontline workers. And then 6 weeks after starting the program, we were already at 60 and above. And essentially 10 weeks after starting the program, we were at 45 and above, notwithstanding the fact that we are the second largest population in the world. And coverage in the groups that had been identified as priority groups was actually pretty low and continues, in fact, to be low. So we did all the right things, but we did them on a very accelerated time scale, and we did them in the absence of a supply. So who do you now say got it wrong? If we look at the projections that the vaccine companies made, the vaccine companies were projecting a very rosy picture, particularly Serum and Bharat, telling us that they were going to have, Serum was saying we'll have 100 million doses a month by the end of December, whereas actually we wound up with Serum not reaching 100 million doses a month until July. And when we heard from Bharat had started off saying we are 100 million a year vaccine. And that meant that they would be doing a few million doses every month. And that's actually what we've seen. They've been able to do 5-10 million a month. And only now, with adding multiple facilities, have they been able to ramp up production. But I think one of the things that we could have looked at is, one, we did not start immunization with anything like the stockpile that we should have had. And then when we started to roll out the programs, instead of doing a reality check and saying, let's examine how we are doing over the first 6 weeks and then move forward, we just went willy-nilly into let's expand, expand, expand. And we are the largest program in the world. Now, in principle, if there had been enough supply, there would not have been anything wrong with that. But in practice, there was plenty wrong with that. And then you add to the confusion by saying, okay, now states go buy what you want and you have to pay for it, which creates this completely unprecedented situation that no country in the world has seen. Fortunately, that did not last very long. So it was announced at the end of April, it was implemented from the 1st of May, and was rolled back by the 21st of June, thankfully. So now we are back in a situation where the government is procuring vaccines. Still, this really rather odd situation where you're holding vaccine for the private sector when the private sector doesn't want it, because with the pricing mechanism that you've set up, the caps on pricing, the private sector isn't really interested in rolling out more vaccine because their margin has been sliced to the bone. So I think where we are is private sector is getting too much, public sector continues to struggle. And in terms of protocols, there's very little we can do now to roll it back. But states have begun, some states to step up better than others. We just have to keep pushing. We have no other choice.
Okay, no, thanks for that, for that description. I think you've talked of the market, not having, actually kind of predicting, they're estimating the predicted productions much higher than what they were able to do. And some of the policy was probably based on that. And therefore, there was some problem and confusion there. You also talked of the public systems actually going ahead with expanding the age groups, etc., without really stockpiling. There is a third component of it, Dr. Kang, that which is people. That there is a lot of discussion in the media about the vaccine hesitancy, that people are not willing, and that's one of the reasons for slow uptake of vaccines in many places. So, what would you say about that?
I would divide lack of information of vaccines from vaccine hesitancy. And I think a lot of issues that relate to coverage relate to the fact that people cannot get to vaccines and do not know about vaccines. So those are questions more of access to vaccines, access to information about vaccines, and then this separate set of people who have been fed disinformation, are continually fed disinformation, and have bought into the fact that vaccines are somehow dangerous and we need to protect ourselves and those we care about from vaccines. That's a whole different and a much smaller slice of the population. But the problem is, when we are looking at a situation where we need very high coverage of vaccines, we are going to need to address those disinformation problems, because if we don't address them and try to discuss with people what their concerns are and try to alleviate some of their concerns. I'm not in favor of forcing anybody to get vaccinated if they really don't want to, But I think a lot of misunderstanding around vaccines for the majority of the so-called vaccine hesitant population is really a lack of a willingness to respect their point of view, to engage with them in discussion and lay out the science for them.
I can't agree with you more, Dr. Kang. In the areas that we work in, which are the deep tribal areas of South Rajasthan, we see that how this disinformation can be quelled if one understands and respects their point of view, and also makes vaccine available much closer to where they live, rather than it being at a primary health center which is 15 or 20 kilometers away, and that too when you come to know that the vaccine is available only the previous night or the same day morning. So yeah, I agree with that. Based on what we are seeing, at least in rural tribal India. Uh, Anant, are you back?
Yeah, can I see if
Yeah,
it
we can now
get
finally
back?
hear you.
All right, thank you.
Yeah, so shall I repeat the question or?
Yeah, so I got a sense of the first questions that you had, which was more on individual rights and are more libertarian societies or countries perhaps more likely to respond better, or are the ones which are more stricter or with less liberties, the ones which are probably responding better. So, my sense, Pavitra, is that at the heart of any response is understanding that in public health, you do have this kind of fine balance between individual rights and collective rights, right? So you might have certain violation of rights happening in your response, especially in the acute phase of response, responding to a crisis situation, and that is understandable. But when you do that, when you, for example, ask someone to go in for quarantine or for isolation, or you take away their right to travel, or you label them in some way and say, X person has the infection and hence their right to be able to interact with other people is going to be restricted in any way, then you also have a moral responsibility to respond to them, right? And this is something which is not new. There has been a lot of learning within the field of public health because we've been responding to these kind of crisis situations now for many, many years. So right from the 2002 SARS pandemic, I think there's been a whole growth of the need to look at the lexicon we use in public health to go beyond just saying that someone's rights need to be restricted. If you're going to restrict anyone's rights, then you need to also be bring in the principle of reciprocity, which is to say that if you're going to take away my rights to be able to travel or to leave my home, or if you're going to put me in an institutional setup for, say, isolation purposes, then what is it that the state, because the state is the one which is going to take away my rights, going to give in return to me? So, will I have, for example, access to information? Will I have access to food? Will I have access to the ways of communication so that I can keep in touch with my family? And will I be told how long is this suspension going to be and on what basis it is? And is it applied equally for everyone, right? There are no politicians, there are no folks with power who are given preferential treatment. Because if you do that, then of course you will open yourself to a situation where people will say that you are selectively, applying these principles, or you're not being standard in the way you respond. So I think that is extremely important. A transparent set of principles and a reciprocal set of obligations from society whenever anyone's rights are violated. Now, linked to that also is a requirement for solidarity, which is to say that you have to recognize that equity is at the heart of any public health response. There are people who are going to be suffering when you take away their right to be able to go out, for example, learn their livelihood on a daily basis. What are you going to do in response? If you expect them to stay at home during a lockdown period, then isn't it our moral responsibility to respond to their requirements of nutrition, of support? And did we do that adequately? Perhaps we did not, and that is what I think Purnima was talking about as well. So, I mean, as a republic, and this is especially important because that we are we're celebrating the 75th year today of our independence. That justice is at the heart of our republic, and justice requires us to be fair and equitable in the way that we respond. And of course, pandemics are times where you can take away rights of individuals, but you should not do that without providing them a response which recognizes them as human beings and communities and with their needs, and ensures that the state is responding to them in that acute period where you're violating their rights. So I think that applies in any country. So whether if you're talking about, say, China, which might have done better towards the initial period in terms of their lockdowns, Or you talk about New Zealand, which is a much more libertarian state and also did pretty well in most of its responses. I think at the heart of it has to be these principles.
So let me just be a bit more provocative, Anand. That people say that countries where, like China, you gave the example of China, that in earlier times and even during the resurgence of the virus there, they were extremely strict and disciplined and almost draconian, and said that everybody needs to be tested. There's no way out, and that led to a rapid containment of the epidemic. And people say that the problem in India is because everybody has a right to go and do whatever they can. For example, we saw that the preceding the second wave, there were a lot of social and religious functions where people had at some point the right to participate, but that did lead to increased transmission in many cases.
Yes,
So how
in
would
my
you?
opinion, anything which is mandatory in nature should be our last resort. I am not in the favor of putting in mandatory measures as our first response. If we work with communities in trying to make them understand why is it that we are taking certain steps, why is it that we have a request that everyone use masks, why is it that we want more and more people to take vaccines, why is it that we impose steps like lockdowns, that is where public communication at the heart of it is extremely important, and responding to any concerns people might have. But if you just impose steps like lockdowns and don't at the same time also respond to real time needs which individuals, families, and communities have, then we are going to have the kind of crisis situations that we saw with large scale labor migration. And how were all of those individuals treated? All of us saw the visuals at our borders where people were being sprayed with basically bleach or disinfectant. Is that how we want our citizens to be treated? Absolutely not. I think, of course, public health is important, but public health cannot be at the cost of dignity. And dignified public health responses requires us to keep these important values of how we want to, treat our own fellow citizens in mind, or anyone actually who lives in this country. So I am very much in the favor of working with communities for our response, and keeping any mandatory measures only as our last resort.
So just to kind of sum this, okay, can you give an example of a country where they did not have, the acute and a rapid and a complete withholding of rights, and still were able to manage the epidemic well?
Yeah, so I think, as I was saying, probably New Zealand did pretty well. Some of the Southeast Asian countries did well. In our neighborhood, I think Sri Lanka has done fairly well too. And again, it is linked also to countries where health systems probably are more resilient, right? I don't think you can talk about a public health response in isolation and forget that wherever health systems perhaps have more capacity to be able to respond, that becomes important. So I think that that's also an important element when we talk about these issues.
Okay. Okay. So what you are saying, Anand, that there is a way out where engaging people, working with the communities, would lead to is probably the only way to address the emergencies, which will also probably promote collective sense of responsibility. But it does require working with people and kind of respecting their points
Yeah,
of
I mean,
view.
I'll just make a quick point. The one concern I have, quite honestly, is that a lot of our pandemic response over the last 1.5 years is what I call a danda response, which is basically a law and order response. It has been driven by home ministry, it's been driven by collectors, it's not been driven by public health experts. And I think that's the change that we need to bring in, by bringing in more capacity in our health systems for leadership from public health experts, rather than it being led by folks who don't have the public health orientation.
Okay. So you made a point about the resilient health systems as well earlier. I take that point. Um, Coming back to you, Purnima, that there was this after the following the initial lockdown, and subsequently there has been a decreased access to food. There has been kind of a loss of livelihood that you mentioned, and you did mention something about the U.S. survey and as one of the ways ahead. Would you say that moving ahead, how do we ensure that there is a greater access and addressing other uh, problems that were created due to the pandemic, while also promoting collective responsibility and the state action?
Yeah, thanks, Pavitra. So, I think so. One of the things that's interesting to me in public policy and public policy is so important for what we're talking about here, is if you don't you have to recognize the problem first and recognize it in its fullness, before I think, and then many different actors in the public space have to align around, okay, what's the set of solutions to that problem? I think with COVID, it was very, the recognition of the problem was very clear and even across anyone who needed to respond to that problem. And therefore, then the set of responses that unfolded, never said COVID itself is not a problem, right? Unfortunately, in the world of food security, in the world of poverty, even, I'm not going to say nutrition so much, because I think, it took us many years, but we finally accepted, at a very large public policy level, that India has a fairly dramatic nutrition problem, the way we define it. But with food security, hunger and poverty, and the loss of livelihoods and economic performance, we're operating in a public space where our problem recognition itself is very, very uneven. Different people have different opinions about how people have been affected by the pandemic. And part of that is that if you recognize the problem differently, if you don't see the problems, if you see them from the lens that you may have for solutions, you're not going to deploy a set of solutions that actually tackles that problem. So we are in a situation where, you have, so we have the consumer pyramid household surveys by CMIE, and for those who've been maybe following the economics and livelihoods work, which, I have to do as well for my work, there's a lot of debate on who's captured in those surveys, and, are they sort of really capturing the poorest of the poor? And if they're not capturing the poorest of the poor, then what can we say from this one body of data that we have? And so problem recognition, to me, we are really lagging on recognizing the extent, the nature of the problem of food insecurity, lost livelihoods, hunger, like very sort of basic. These are very basic things. I'm not even talking about nutrition. I'm just saying we just today don't even know and recognize in a uniform way, who's hungry, who needs help on livelihoods. And without that recognition, it just means that our policy response and our societal response also is going to end up being uneven and patchy. And so the US Pulse survey I like, because they recognize that they needed data. They recognize it would be problematic to integrate it into standard, existing data systems. And so the Census Bureau decides to launch something that's experimental, but still bringing in data with agreed upon questions and things like that.
Just to interject there, you talked of the societal response, right? And that's the point, that while on one hand we say that, okay, policy needs to be better, and especially in this case of the pandemic that we're talking of and its subsequent outfall.
Yeah.
How do you promote a societal responsibility and a collective
action, exactly,
irrespective of the governmental action?
Exactly. So we have to understand the emotions that drive civil society action. The emotions were very strong around the time, so a basic societal response, in terms of people with more doing things for people with less, that comes from an emotional space. It does not come from a data-driven space, and I think we saw that. We saw how society and people with more responded to help people with less in times when, the media reports were high, when you could see with an emotional, with your heart, you could see how people were being affected. Those people are still being affected. We just don't see that, right? And so it does not, the images, the things that evoke sort of a societal, personal response to the distress of another human being, that is not apparent to us in the same way. We saw that with the oxygen crisis in Delhi, in our cities, right? People saw the crisis at a very emotional, very personal, very visceral response, and responded in very powerful, personal ways. But that's never going to be enough for a society, right? Because some of us will continue, some will continue to volunteer, some will continue to donate, some will continue to, feed the poor. But there has to be sort of a base response, and that base response is exactly what Anand said about public health. It comes from sort of social sector programs that continue to pay attention to what's happening to the poor in a data-driven way, in a thoughtful way, and just keep tailoring our public responses. And if needed, eliciting societal responses as well, you know. But without the surveys or without sort of the images coming out of how the poor have been affected, we're not going to see at an individual level, so, you know, those sort of societal responses. So, you know, I don't know what we can do about this. I think it's bad for society and for politics and for public policy to not have information continue to come out at us on how the poor have been affected. They continue to be affected. Every survey that we do will tell us that. The depth is not visible, the desperation is not visible, but people are still affected. We're just not seeing it as much at a societal level as we probably should.
Sure. Dr. Kang, just coming back to you and on the vaccine question again, that while there have been problems of inadequate and inequitable vaccination in India, it's also a global problem. You know, the global South is really reeling with Africa and other countries really not having enough vaccine, and there doesn't seem to be any clear direction in the future. So what do you think needs to happen to promote equitable access to vaccine? Of course, it is right now, it's a question of timing that there isn't enough production, but there is also a question of cost and reach of the vaccine in many places, and how what do you think needs to happen, and is the role of the governments and the market and people in there?
So there's not much we can do about the markets. It's not a question of there being not enough money to buy the vaccines, because the World Bank and the regional development banks have stepped up to say that they will make financing available for countries to buy vaccine. But there isn't vaccine to be bought, and there isn't going to be vaccine to be bought for a few months still. We'll get these little dribs of vaccines, 10 million here, 3 million there, a few 100,000 doses of vaccines going to some countries. And that's pretty much going to continue, at least largely for the next 3 months, probably the next 6 months. And then next year, we are likely to have a lot of vaccine available. So there will be, it's estimated that we'll be making 14 billion doses of vaccine next year. Not sure that we will actually need 14 billion doses of vaccine next year. What we can do to change things now is only what rich countries can do. And rich countries can not stockpile. They can distribute what they've got as quickly as possible, make sure that they get it to the countries that have the lowest coverage in the world, and help to protect those countries. There is a lot of discussion around booster doses and whether elderly people should be given booster doses. Some countries have already started vaccinating their over 60-year-olds. I think the data that support a booster dose strategy for the healthy elderly is not yet available. It's possible that there will be some small incremental impact. You could get some slightly better protection, but that's slightly better protection with a whole lot of doses that could have made much more of a difference in countries that have not managed to get people to their first dose as yet. It's possible that there will be a need for third doses or boosters for people who are immunocompromised for some reason. But other than that, I see no evidence emerging that anyone that has received 2 doses of vaccine actually requires a third dose at this time.
Yeah, while some countries have probably already started the policy of a third dose or a booster dose for some populations. So good. So what you're saying is that the solidarity between rich and poor nation and rich nation need to understand that they need to share what they have with other countries, both in terms of the current, because of the current levels of production, as well as ultimately the cost of the vaccine, which many countries may not be able to afford. I've got a lot of questions here, and I would probably just shoot some of them to to you, Anand. I'll begin with Anand. There are two questions which are related and are opposite in nature. The first question was related to that: is it a right to attend a social or a religious gathering in face of an epidemic? And the second related was that what should government do to ensure that human rights are not violated during the. So these are kind of juxtaposed together. So it's a difficult one for you, Anand.
Yeah, thanks. Those are, yeah, it is a difficult one. I mean, there are social events and there are social events. What I mean by that is, I think what we should not be taking away from individuals, families, and communities is things which are very dear to them for any reason. For example, if there is an important festival, I would rather suggest that we hold that festival in a symbolic manner rather than not hold it at all. So, whether that be any kind of an important, meaningful, small event where a few people come in and you conduct whatever rituals are required for that. Similarly, the fact that even when there was now adequate evidence, families were kept away from funerals of their family members who died of COVID, and they were not allowed for closure. That is, you can call that a kind of a social event because it's an important part of our culture. It's important for families to get some element of closure, but the fact that they were kept away from it, sometimes were not even informed, funerals were already happening, and then later on perhaps they got access to ashes, etc. I think that could have been avoided, especially when evidence came through. If it would have been, it would have been more humane to allow for certain social events around that to happen. Having said that, when you, on the contrary, start having social events where it's considered okay to go beyond guidelines which are applicable, where people come in and masks are not used, where ventilation is not ensured, and where numbers go much beyond what is manageable in that situation, then of course that's where the role of the state comes in to step in and explain why that is not acceptable and this is not the time to do it. Those kind of sacrifices, of course, should be demanded of and expected. Violation of rights, as we talked about earlier, also, I think there are times where violation of rights might be acceptable, but only if it is transparently done, where there is no subjectivity and where there is a clarity of the purpose, and that is a very time restricted measure. And when you are violating anyone's rights, you of course give them something in return, so that whatever is their requirement for them to be able to sustain themselves at that point of time, it has been well taken care of. It cannot be something which is indefinite in nature.
Thanks for that, Anand. And Purnima, to you, it's a related question. And the question is that when rights are not secured, can the system demand of duty and responsibility from the citizens?
It's I'm not a constitutional expert or anything, but I think the two go hand in hand is probably the safest thing to say. I mean, each of us has rights as individuals, but we also have to sort of really view our tremendous responsibility to each other, and I don't think it's duties to the state. I mean, the way that I think about citizenship, or just being part of a society, is that if you're part of a caring and humane society, you will consider how other people are affected by the ways in which you want to exercise your rights. I mean, we are seeing quite a remarkable breakdown around some of these things in the US right now, with masking behaviors, and where do sort of my rights end? What is the intersect between my rights and your right to live a healthy life, etc. So I think it's not about what's written in paper. This has to be how we view ourselves as human beings in a social setting, above everything else. If we care for our fellow human beings, then what we're asked to do to protect other people should not seem like a duty to some state. It's a duty, and it's for the people around us and for the most vulnerable among us. I think for me, Gandhiji's talisman, in a sense, for me is, it's really very powerful. I think about that a lot. What do I do, and how does that affect some of the most vulnerable people in my society? If we're not thinking about that, then I think we're sort of not operating in a humane way. So beyond what's written in constitutions, I think there is a place for just human beings in social settings here, right? In compassionate
Thanks
societies.
for bringing that, Purnima. I think that's extremely critical. And yeah, I mean, you can write whatever you do, but what you live is really important and live on a day-to-day basis.
Absolutely.
Dr. Kang, there's a question for you. It says that are there any advantages of having a public-private mix in delivery of vaccines?
Oh, absolutely. And if we look at the role that organizations outside government play on the ground in terms of supporting people to get access to healthcare, it's not just about vaccination, it's about all kinds of ways of accessing health. What we need is for the government to facilitate these kinds of interactions, because many of these groups are doing what the government itself cannot do. They are filling in the gaps. And you know it better than anyone else, Dr. Mohan, but I think there are plenty of non governmental organizations that are providing services that go above and beyond what the government does. And they are critical. Now, involving them in their vaccination would be one of the best ways of doing things now. I know that it is already being done by many such organizations that have sourced donated doses from companies, from private individuals. But if the government could look at the micro level at identifying partners and making sure that these partners assist in improving coverage, especially for those in whom early improvement in coverage is very important, which is the elderly and people with comorbidities who may not necessarily be able to get to the government centers. That's absolutely, we should be doing that.
Okay, thanks for that kind of very clear response. It's not complicated. And there needs to be more partnership. Rachita, can you just put up the scores of the poll on the screen to get done with and see that what people feel about some of these binary questions with complex answers? Yeah. Do we have the scores here?
Dr. Mohan, it's on the screen. Are you unable to see it?
Yeah, I can't see the scores. I can see
the votes. These are the votes we have received.
Okay. No, I can't see the scores as well. But
so we can.
But if you can just maybe, yeah, if you can just speak out, yeah.
Okay. So what comes first in your opinion? Rights or duties? For rights, we have received 11 votes, about 34%. Whereas for duties, we have received 22 votes, which is about 66%.
Yeah. Is that the only question, or
no, there are more? There are more. I'll just go one by one. So this was the second question we had. Should the fundamental right to freedom hold true in case of public health emergencies such as COVID? About 56% of the people have voted a yes versus a 44% for a no. And now the votes are changing actually. So 50%, 48% for a yes.
Interesting.
Then we had the next question was, should quarantine be a voluntary or a mandated measure for disease suspects? 12% of the people said it should be voluntary versus 88, now about 89% saying it should be mandatory.
Okay, thanks. And I think it does tell of the views people have. And I hope that this session and this discussion would have further provided some thoughts and some fodder for reflection further on some of these issues, which are extremely difficult to put in black and white, as Purnima was saying rightly, that it is what you make out of what is written in the constitution or what is written in the rule book, of how do you value others, how do you value especially the most vulnerable, and how some of these things play out in practice. And I actually, at the end of the session, I try to sieve out some of the key kind of discussion point that might help us in these reflections of the discussion on individual rights and collective responsibilities. I would not call it individual rights versus collective responsibility. I would call it individual rights and collective responsibilities. There is no fight between the two, and therefore I think this binary discussion is probably not the right way to look at it, but it is a good question to pose. Some of the things that I take away for me from this session: one, I thought that there needs to be a greater communication between the governments, the market, and the civil society and people themselves. Most importantly, how do you have an honest, transparent, timely communication? And that would probably help in both ensuring and promoting responsibility as well as ensuring rights. In absence of that, there are positions taken which can become stiffer and can lead to confusion. And second, and the related point, is participation. Whether it was participation in the initial phases to discuss what should be the right policy, where should we be going, how do you ensure that livelihoods are preserved or the food security is ensured. Some of the participation of different players and honest communication between them could, again, ensure both responsibilities and promote rights. Uh, Third thing that I took away from it was that the resilient health systems, I think they are critical. If the systems are resilient, and I would go a step further based on our own experiences, is that trustworthy health systems, while resilient would mean that they are not affected by the pandemic and they continue to provide care, trustworthy means that people continue to trust them in normal times and in emergencies. And therefore, they are both able to ensure the right to access to healthcare as well as promote responsibility because people have trust in them. So I think resilient and trustworthy health systems would be another kind of a critical. Yes. Fourth, I think the fourth or fifth, whatever. I'm bad with numbers, but the next, I think, an important point was that people did really respond to the situation, and there is a societal response, and that's something we should not kind of undermine, and actually see that how can it also be promoted not only in the times of absolute emergencies or uncomfortable scenes around it, or when your own people are affected, but also in normal times. Can data be the solution? Is promoting a more compassionate society? How do we create that? But the power of people, what we saw during emergencies, is it something that we can promote and foster in normal times as well? And that would again be both, which is both engaged, undertake the responsibilities, and also ensure that everybody, especially the most vulnerable, rights are protected. And finally, I think the equity, that who is collective, and is the middle class the collective? Are the people who are on this panel or people like us? Do we form the collective? Who really forms the collective consciousness? How do the voices of those who is not heard in social media or on media, are they the part of the collective that we are talking of? Are their rights? How do we promote their rights or protect their rights? How do we ensure that they are engaged in their own development and growth, and therefore become more responsible, responsible citizens, so to say. So with these, I think these are some of the considerations. So when faced with how do we create a society, so I would think at the end that we should not think of this pandemic as and find out only solutions for what do we do now. But I think we have to dream and envision that what kind of society are we talking of? Is it is a society where there is greater communication, there is greater participation, there are resilient and trustworthy public systems, and where equity and the face of the most marginalized is what is prioritized, whether they are underprivileged or elderly or whatever. So if that is the society we are dreaming of, then I think it would be a society where responsibilities would come naturally and nobody would have to really fight for accessing their absolute basic rights. So with these words, I would like to thanks all the panelists. Really privileged to be with all of you here, and thanks to all the audience, and of course the organizers, and happy Independence Day once again. And I think if we can, on this Independence Day, we have this vision, it will be a great kind of a start. So thank you, everyone. Thank you.
Thanks a lot. What an amazing session. It feels wonderful to end this Health Track of Charcha 2021 on such a high note. Thanks to all of you. The theme of the health track, the forgotten amidst the pandemic, was chosen this year with the hope to bring to the fore the issues which had taken a backstage during the pandemic. We do recognize the importance and the urgency to address COVID-19 more so because of our work in aspirational districts at national, state, and district levels, where we have been working very closely to minimize the impact of COVID on a war footing. In fact, during this time, we realized the disruption of services, the routine health services were falling behind. So, our endeavor has been to table this and hear from the experts. So, over the last 3 days, we had the privilege of listening to great speakers with Dr. Reddy's opening address, which provided us an overview of the pressing public health issues today, issues that we cannot neglect anymore. The session on recognizing differences brought together an extremely interesting set of speakers who highlighted the plight of the vulnerable sections of the population, such as tribal communities, people with disabilities, sex workers, among others. There are many, we could only pick and choose some of those, and we brought together the challenges they face in accessing basic health services, especially during the pandemic. Dr. Pathare's session, which was on mental health and mental health care, was very enriching. His articulation of complex issues in simple words were brilliant, as was Dr. Vandana Shiva's speech, which was on a perspective on emerging One Health approach and bringing together the most important word in today's time, sustainability. We also touched upon menstrual health and NCDs, each panel bringing with it experts from the field. And today's session, as rightly said by Dr. Mohan, that it is not a binary. It's not individual rights versus collective responsibilities. It is and collective responsibilities, which has left us with pertinent issues to consider as these affect lives of each one of us. So it very nicely summarized by Dr. Mohan that an increased dialogue between the citizens and the government, citizen engagement, and a health system that we can trust came out as important ones, not to miss on the research component, hearing societal voices, picking in those, and planning around it. On behalf of Piramal Swasthya team, I would like to share my gratitude to all the speakers for being with us in this journey together. We would like to thank the Nudge Foundation for trusting us in curating the health track and supporting us throughout. As always, it has been a pleasure to work with you, Sudha, Ghana, and everyone else working behind the scene. A big applause to the Piramal Swasthya team who have worked relentlessly to curate the sessions, making it a big success. All the recordings of the sessions will be available at Piramal Swasthya Facebook page. Have a great day. Jai Hind.